grew up in a village about 100 miles east of Saskatoon called Anaheim, and I was in general practice, we called it in those days, family medicine, for 4 years here in Saskatoon. Then went to Montreal where I finished internal medicine and then respiratory medicine at the Royal Victoria Hospital and McGill University. I came here, back home, and I sensed that working with the Lung Association, we would have a connection for our research that would be difficult to duplicate.
His team were the first in Canada to actually create a center, a research teaching service center at a university whose focus was specifically on agricultural health and safety. And then that grew into today's Canadian Centre for Health and Safety in Agriculture.
In 2018, the College of Medicine received an Aspire Award for social accountability. And that's an international award that recognizes medical schools that truly serve their own community. And so what Jim did in starting the research on the effect of grain dust in elevator workers, farmers, rail workers, was truly doing research on illnesses that impacted the farm workers of Saskatchewan.
We held an international symposium on grain dust and health, and that led directly to a national program for the protection of grain elevator workers in Canada.
Whether we're talking about research or we're talking about knowledge translation or we're talking about team science, he's always brought people together to better the health of those who live in rural areas.
Jim's team was the first to engage farm families in a membership-driven coalition supported by municipalities so that the university, the researchers, could engage in singly and groups with those farmers and farm families and communities to help them to see where safety could be an issue.
So what started as 4 rural municipality members has now grown to 219 in the province, with about 27,000 farm families committed to their own health and safety and helping us vision and research what they need to know that's impacting them.
On the national level, we got people from across Canada together to form the Canadian Coalition for Agricultural Safety and Rural Health. That program, we encouraged the Department of Agriculture to provide $1 million a year for safety, which was a new concept to that department.
And then Jim was able to work through a United Nations program to develop standards for agricultural health and safety globally.
He built and stepped aside, and he's letting others take the lead. So the Canadian Agricultural Safety Association, Canadian Rural Health Research Society, the National Agricultural Industrial Hygiene Lab, and the Canadian Centre for Health and Safety in Agriculture. They're his legacies. He built them and then he let them fly.
The idea emerged of establishing a not-for-profit company in agriculture called AgriVita Canada. And that company has been quite successful in receiving funding from the Federal Department of Agriculture to foster research and fund research that's very applied.
I would say that Jim has mentored, supported, trained future scientists, medical students, and residents in a remarkable way.
You couldn't do it alone. It's all about working with people. And my fabulous wife, Sue, she's been there through all the disasters and all the triumphs, and I'd like to thank you very much, Sue.
There are lives being saved right now in the world because of the work that Jim Dosman has done.
Canadian Medical Hall of Fame laureate, Dr. James Dosman.